thrombus is a blood clot in a vein, artery or heart. A blood clot can completely or partially block a blood vessel. A blood clot can form either when blood flow is too slow or when clotting occurs when it is not needed. A blood clot can form in any blood vessel. A common type of thrombosis is a blood clot in a vein of the leg. We call this deep vein thrombosis. If the blood flow is obstructed, the blood can't be pumped through the vein anymore. This causes pressure in the deeper veins and capillaries, and the leg gets red, painful and swollen. This swelling is called edema. Possible causes of thrombosis can be slow blood circulation, damaged wall of the blood vessel, changes in the composition of the blood. There are some hereditary disorders.
Angiopathic anemia. Microangiopathic anemia is when red blood cells are damaged when passing through obstructed or narrow vessel lumina. So basically the red blood cells are getting damaged when it's trying to squeeze through. Name some conditions that would lead to microangiopathic anemia. Conditions that can lead to microangiopathic anemia include disseminated intravascular coagulation, thrombotic thrombocytopenic purpura or TTP, HUS, which is hemolytic uremic syndrome, lupus, and malignant hypertension. What type of cells would you see if the red blood cells are getting mechanically destructed in case of microangiopathic anemia? In cases of mechanical destruction, you would see formation of schistocytes, which are also known as helmet cells. What is macrocytic anemia? Macrocytic anemia is also a similar concept to that of microcytic anemia, in which there is mechanical destruction. But in macrocytic anemia, the reason for the mechanical destruction is due to prostatic heart valves and aortic stenosis.
Blood cells are produced in the bone marrow. The three main components of blood are red blood cells, which carry oxygen, white blood cells, or leukocytes, which fight infection, and platelets, also called thrombocytes, which assist in the formation of blood clots. When a blood vessel is damaged, platelets adhere to the surface of the damaged vessel and release chemicals. These chemicals attract more platelets as well as red blood cells in order to form a clot or thrombus. As the clot grows, the blood vessel narrows, thereby decreasing blood loss. This process is called coagulation. Normal platelet counts are in the range of 150,000 to 350,000 platelets per microliter. Thrombocytopenia is a disorder in which there are not enough platelets. When the platelet count is decreased, the body is unable to form blood clots and therefore is unable to control bleeding. Bruising and bleeding can occur from relatively little trauma. When the platelet count gets below 10,000 platelets per microliter, bleeding can develop without trauma. Chemotherapy-induced thrombocytopenia is a disorder that develops as an adverse effect of chemotherapy. Cancer drugs not only kill cancer cells, they can also damage the platelet-forming cells in the bone marrow. The severity of this disorder depends on the type of chemotherapy and the duration of treatment. Fortunately, chemotherapy-induced thrombocytopenia can be managed with
Patients with the following conditions should be considered for kidney transplantation: Thrambotic microangiopathy, or hemolytic uremic syndrome, is a disease of unknown origin characterized by abnormally low levels of platelets in the blood, the formation of blood clots in the arterioles and capillaries of many organs, and neurological damage. Antiglomerular basement membrane disease can be defined by the presence of a triad of glomerulonephritis, pulmonary hemorrhage, and anti-GBM antibodies. Primary or secondary amyloidosis develops when specific proteins known as amyloids are abnormally deposited in the tissues and organs of the body. The deposited amyloids impair the function of organs, making the condition potentially fatal. Systemic lupus erythematosus is a chronic inflammatory autoimmune disorder. It may affect the skin, joints, kidneys, and other organs.
Well, here we see a coronary artery that's been cut open at post-mortem. And I think you can see there's a dark area of thrombus there, occluding the coronary artery. And here we see the longitudinal nature of the thrombus. It's blocking off the length of the artery. So it's not surprising that there's no blood can get from here down into the distal artery. And therefore the area of myocardium normally supplied by that artery will be completely occluded and infarcted. And this is red thrombus. It will cause a complete occlusion, infarction, and this will cause a STEMI, ST elevation, myocardial infarction. And it's just a pity that no one got this thrombus out before it caused the death of this patient.
Gone through 6 IVF cycles to get pregnant the first time. I had a 72-hour migraine and I couldn't function, and I was starting to lose my words and I couldn't complete sentences. So we went to the ER and they must have tested my blood 3 times because they thought it was a mistake in the lab. The hematologist ran in, they rushed me up to the ICU, they put a catheter in, and they threw out this word TTP, which nobody has ever heard of. It stands for thrombotic thrombocytopenia purpura, which basically my blood attacks itself and my platelets diminish. I was 17 weeks pregnant at the time with our son. I stayed for 2 months in the ICU. Unfortunately, at 27 weeks, the doctor said basically it was my life or his, and I delivered him and he was born still. And then, about a year and a half later, I was late and I took a pregnancy test and I was pregnant.